Sleep apnea can be defined as a condition where there is a partial or complete closure of your airway pathways. There's 3 different types. There is obstructive sleep apnea, in which case there's complete closure of your airway. There's central apnea, which means that the receptors and the actual mechanism that's in the brain telling you to breathe, there's a malfunction in that. And then we have mixed apneas, which is a combination of the 2. We have snoring, snorting, disorders when you're actually breathing and you have this gasping, and suddenly getting up in the middle of the night feeling as if you just don't get enough air in your body, excessive daytime sleepiness, tiredness, a reduction in your alertness in your day-to-day activity. There are many other signs and symptoms, but these are the basic ones that I think most people can identify with. Undiagnosed sleep apnea, you can actually die from it. So these are the cases where patients just die in their sleep. These are cases that you hear of that they'll say, oh, I don't know what happened, but they just suddenly passed away in their sleep. And that's just because they've had a massive attack of obstructive sleep apnea and they've just never recovered from it. Your body's mechanisms have worn down to such a point that it doesn't kick in for you to actually wake up from that. Normally what happens is when you have an episode of obstructive sleep apnea, you actually go into a state where the body then tries to wake you up. So that's why you have this, and then you suddenly get up and then you gasp and you do all those things. And that's your body's mechanism to say, wake up, because if I don't open up your airway now, you're going to die because you're just not going to get that airflow. So that's why any kind of sleep apnea should be diagnosed and treated as soon as possible, because untreated sleep apnea can actually lead to death. But other than that, your risk factors of high blood pressure, diabetes, kidney issues, in fact, you name it, it goes all the way through your body. Because when you're sleeping, you're supposed to be on a sleep mode, which means your hormones, your chemicals, everything should be at a rate which is just ticking along. But when you're having disturbed sleep, you are in a state of a little bit more alertness, meaning that all those chemicals and hormones are still flying through your body, meaning there's more stresses on all the different systems in your body, which then leads you to having more cases of high blood pressure and diabetes, and as I mentioned, all the other above illnesses and chronic problems, ocular problems. It just goes everywhere through your body.